Hi guys, welcome to our Sunday instalment. This one's been filmed in advance because I'm going away tomorrow for a week. Excuse firstly the sunburn on my face and arms. I spent too long in the sun and got quite severely burnt. Anyhow, we have a question here from Romy, or Romy, that's R-O-M-Y, and she or he asks about cancer and symptoms and signs of it. I suppose we'll do this obviously in relation to Charlotte's cancer rather than cancer generally, because all the signs and symptoms are different.
Yeah, so I think with Charlotte, she was diagnosed in July 2013. In April 2013, she started to get headaches. I thought they were migraines because the family does have a history of migraine. And she went to the doctor a couple of times, and she seemed quite concerned about it because she'd mentioned to me about a brain tumour, and I said, well, I really don't think it's a brain tumour, you haven't got any sort of other symptoms. Anyway, the headaches started to get worse, and we started to document them and how long they were lasting. And then I remember one thing she said, that when she lied on her stomach, she had this awful sort of ringing in her ears. And in fact, on 3 separate occasions, she said to the doctor, I've got a brain tumour. And she was told, no, you haven't got a brain tumour, you've just got a migraine. And she said, I know I have a brain tumour. I don't know how she knew, but she did know. There was no sickness, which made me think it wasn't a brain tumour, because I believe sometimes you can be sick with it and pressure building. And in fact, it did turn out that the headache obviously was pressure, because the tumour was stopping the fluid going around the spine and the brain. And when she eventually had a lumbar puncture, I was told that, I don't really know much about this, the normal pressure is about 10 of the spinal fluid. Hers was actually at 40, which is why she was having these severe headaches. And when we eventually got admitted in July to the hospital, in the evening, she said to me, go home, I'll be all right. And I didn't get much sleep, but there were a load of texts, and when I went back, she was just whimpering like a really, really sick animal. She was in absolute agony with the pain in her head. So I think for Charlotte, it was pain in her head, severe headache, and her shoulders felt like lead. She said they were so heavy and they hurt, and they were very, very, very hard, because I remember sort of trying to massage them before we actually had the diagnosis of what was wrong. So in Charlotte's case, those were her symptoms. I think they're different for everybody, but those were her symptoms.
And she also had the optician's report.
Yeah, and when we went in, they had a look, I have said this before, they had a look behind the optic nerve, and that was swollen, which is a fairly good indication that there is a problem. And sometimes that can be just diagnosed when you go for a normal eye test, which I think, I feel sorry for the optician, because that must be, they said if they'd seen Charlotte's when it was so bad, they wouldn't have known what to do. Well, they would have obviously sent them straight to hospital, but I saw the images and they were pretty awful.
I think that's one of the worst things with brain tumours, is because the symptoms are so ubiquitous to everyone really. Everyone gets the odd headache, and a lot of people get migraines, so it's difficult to be believed by GPs, especially because they may not see a single brain cancer patient in their life, so it's kind of understandable, if not actually acceptable, that they are quite misinformed about it or don't exactly know what the proper procedure is. But I'm quite keen with the idea that if you go to a GP 3 or 4 times with a recurring headache and you've been put on migraine or other suitable medications, that you are then immediately taken to hospital, in the same way that if you went to the GP once with chronic chest pains, you would be immediately taken up. So yeah, those are my thoughts on that.
Yes, I mean, we basically sort of, we'd love to see some sort of changes with that happening. We're going to obviously try and campaign and see what we can do to raise awareness of glioblastoma, which is also why we've kept this channel going.
This is from Yvette Neal. First of all, Yvette says, first of all, I am your fan, so you can say fan request. This is in relation to a video I did 3 or 4 times ago actually, in which I corrected myself saying fan request to viewer request. So thank you, Yvette, for being a fan and allowing us to say fan requests, and thank you for your fan request. Yvette asks for some feedback on healthcare professionals, namely nurses, as Yvette is a nurse herself.
Well, we saw so many people over 2.5 years, as I'm sure you can appreciate. We were cared for, Charlotte was cared for by some excellent professionals. She was also cared for people who I'm afraid I didn't get on with. I started questioning what people were doing. I think when you're first into this cancer thing, you don't really understand enough of what's going on, and you take everybody, whatever anybody says, that that's the absolute truth with what's going on. But as the journey went on, I did start to query medications that were given to her. In general, I would say we had an awful lot of support. We met some very, very good people, but we did come across people who I didn't gel with for one reason or another. And I'm afraid my motto on this journey was I wasn't carrying anybody on the train. I just couldn't afford to. I had to put what I felt was Charlotte's best interest first. So towards certainly the middle and the end of it, I did start querying everything that was done, why she was having particular medication, rather than just people, pumping stuff into her. You have to bear in mind with Charlotte and the cancer, she had to have bloods every single week. That just became routine, and sometimes there were people who could take the bloods really, really well, and there are other people who just couldn't, and it used to frustrate Charlotte. She used to say to me, I just feel like a pincushion. Generally though, we were pleased with the level of nursing, especially towards the end. It was very traumatic, but we were looked after well by the nurses, so thank you for that.
Sorry, we haven't actually got a name for this request because you
That was my fault, I'm sorry.
Yeah.
I copy and paste it onto Word, and it was only fairly recently I started thinking I must put people's names, so I apologise for that. Honestly.
This person asks, and you'll probably know who you are. If you're able to please include how a relationship changed with Charlotte after news of her cancer, and also if she received any kind of psychiatric therapy for dealing with her diagnosis. I think in regards to this question, because of the general theme of the video, we'll stick to the latter part of it, because we have talked before about how cancer affects familial relationships. But yes, Charlotte did indeed have psychiatric support.
We did have support at the Marsden, because as you can imagine, for a 16-year-old suddenly thrown into the world of cancer, not knowing whether she was living or going to live or going to die, we had quite a lot of support. We also had support down here in Brighton. We had somebody locally looking after her. I think that the problem was the lady was really, really lovely, but the problem was she was used to dealing with older people that had cancer, so she found it terribly difficult to try and counsel somebody of 17 or 18 as opposed to, say, somebody of my age or older. So Charlotte found that it helped in a lot of ways. The psychiatrist that we had down at the Marsden, he obviously looked after all her medication and antidepressants and stuff, and would make sure that she was on the right dose of that, just to to help her get along. But I think without that, she would have been without any sort of support, it would have been very, very hard for her. Next week I've got obviously there's nothing on Wednesday, and next week we've got a few more questions which people have asked for, and please feel free to ask. And then we will start on Charlotte's cancer journey and the 2.5 years, and maybe talk a bit more about what Miles and I would like to try and do with the future, and raising awareness of this terrible brain tumour.
Yeah, just to prove I wasn't aimlessly looking at the floor there, I have a cat. So yes, I mean that's what we intend to do, is just obviously spread the message forward to you guys and explain in the best possible terms what Charlotte's journey was. And now I think we've obviously cleared most of the stuff that people asked for during Charlotte's early years. Now we can fully focus on that.
Yes, on her actual journey, and yeah, it was a long one, and hopefully I think people will find it quite an interesting one.
Well, thank you for watching, guys, and we will see you on the Wednesday.
No, because you won't be here. We'll see you on the following Sunday, because we will do it and then be able to do the video, because you'll be back from holiday.
Okay, well thank you for watching.
Thank you.
Bye bye.